Every single morning, you stand in front of a mirror, you brush your teeth, you fix your hair, you check your skin, and you stare directly at the one organ that is showing you exactly what is happening inside your body. You see nothing, not because it is not there, because nobody ever taught you what to look for. Your eyes are not just for seeing, they are the only place on your entire body where a doctor can look directly at living blood vessels, nerve tissue, and arterial walls without cutting you open. No incision, no scan, no contrast dye, just a direct, unobstructed window into the vascular and neurological health of your entire system. That is why ophthalmologists sometimes catch diabetes before your endocrinologist does. That is why they spot cardiovascular disease before your cardiologist raises a flag. That is why a routine eye exam has picked up brain tumors in people who walked in complaining about a mild headache. This is not cosmetic. This is not about eye bags or crow's feet. This is survival information sitting right on your face, visible every morning. And you walk past it because nobody in a clinic ever sat you down and said, "Here is what your eyes are actually telling you." Today I am going to show you 7 signs of serious, potentially deadly disease that show up in or around your eyes, often months or years before any other symptom appears. These are not rare conditions. These are the diseases that fill hospital wards every day. Heart disease, stroke, liver failure, thyroid dysfunction, and every single one of them leaves a fingerprint on your eyes that you can learn to recognize. Nobody at your next appointment is going to walk you through this. So let's do it right now. To understand why your eyes betray disease before anything else does, you need to understand one piece of anatomy that most people have never been told. Your retina, the thin layer of tissue lining the back of your eye, is not just part of your eye, it is brain tissue. It develops from the same embryonic cells as your brain. It is the only part of your central nervous system that is visible from outside the body without surgery. When a doctor dilates your pupils and looks in, they are looking at living brain tissue, and they are looking at the blood vessels that feed it. Those blood vessels are not isolated, they are direct branches of the same arterial system that supplies your brain. The same system connected to your heart, your kidneys, your entire circulatory network. Damage that is silently building in your cardiovascular system, your metabolic system, your nervous system. It shows up on the retina first. Vessel narrowing, microbleeds, fatty deposits on arterial walls, swelling of the optic nerve. A trained eye can see all of it, sometimes years before you feel a single symptom anywhere in your body. That is why a dilated eye exam is not just about checking your glasses prescription. It is a cardiovascular screening, a neurological screening, and a metabolic screening compressed into one appointment. Here is the critical part. The 7 signs I am about to walk you through are not rare, exotic conditions from a medical textbook. They are the most common killers. Diabetes, hypertension, stroke, liver disease, thyroid dysfunction, autoimmune disorders. Each one leaves a visible mark on or around your eyes. You either learn to read those marks or you ignore them until it is too late. Let's start with the first sign. Go to a mirror and look at the colored part of your eye, the iris. Now look at the very outer edge where the color meets the white. What you are looking for is a pale grayish white or yellowish arc. Sometimes it forms a partial crescent. Sometimes it is a complete ring circling the entire iris. Most people who have it have never noticed it, and if they did, they assumed it was just age. In medicine, this ring is called arcus senilis. It is a deposit of lipids, fats, and cholesterol that have migrated out of the bloodstream and settled into the corneal tissue at the edge of the iris. In people over 60, doctors often wave it off as a normal aging change, and in many cases, that is fair. But here is the clinical nuance nobody mentions. When this ring appears before age 50, or when it is unusually thick, bright, or clearly defined at any age, it can be a visible marker of familial hyperlipidemia. That is dangerously elevated cholesterol driven by genetics, not diet. This is the kind of cholesterol that does not respond to eating less butter. It is the kind that silently lines the walls of your coronary arteries for decades and produces heart attacks in people who genuinely believed they were healthy. The mechanism is straightforward. Cholesterol circulates in your blood. The tiny blood vessels at the outer edge of the cornea are thin enough that lipid particles leak through and deposit directly into the tissue. Your eye is literally showing you what is accumulating inside your arteries. You just have to look. If you see this ring and you have not had a full lipid panel done recently, that is a conversation to bring to your doctor, especially if you are under 60. This one requires nothing more than good lighting and an honest look. Pull down your lower eyelid gently and look at the sclera, the white part of your eye. What color is it? If the answer is anything other than clean white, if there is a yellowish tint, a golden hue, even a subtle warm color that was not there before, pay close attention. That yellow is called jaundice, and it is caused by a buildup of bilirubin in your blood. Bilirubin is a yellow pigment your body produces naturally when the liver breaks down old red blood cells. A healthy liver processes bilirubin efficiently, packages it into bile, and sends it down to the digestive tract. You never see it. You never notice it. The system handles it quietly. When the liver is damaged, inflamed, or obstructed, that system breaks down. Hepatitis, cirrhosis, a gallstone blocking the bile duct, pancreatic obstruction, bilirubin has nowhere to go. It backs up into the bloodstream and begins depositing in tissues throughout the body. The sclera shows it first because the tissue is white and thin. Even a faint yellow tint becomes visible there before it appears anywhere else, before the skin changes, before you feel anything at all. Many people dismiss early yellowing as bad lighting, tiredness, or just getting older. They do not realize they are looking at a liver in distress, and this same sign can point to pancreatic or bile duct obstruction, including pancreatic cancer, which is notoriously silent until it reaches advanced stages. Yellow eyes are never cosmetic. They are never normal aging. They are always a reason to get blood work done immediately. Liver enzymes, bilirubin levels, and imaging if your doctor thinks it is warranted. This sign is one that people live with for years without recognizing what it means. One or both eyes begin to look more prominent, as though something behind them is pushing them forward. You might notice more white visible above or below the iris than you remember. Your face takes on a staring quality that people comment on but cannot quite name. You may feel a vague pressure or fullness behind the eye that does not match any injury or infection. In medicine, this is called proptosis or exophthalmos, and it is one of the hallmark signs of Graves' disease. Graves' disease is an autoimmune condition where the immune system attacks the thyroid gland, forcing it to produce excessive amounts of thyroid hormone. But the immune assault does not stop at the thyroid. It targets the tissues and muscles behind the eyes as well. Those tissues become inflamed and swollen, and that swelling physically pushes the eyeball forward in the socket. Here is what makes this especially dangerous. Thyroid disease is massively underdiagnosed in people over 50, particularly in women. The symptoms overlap almost perfectly with what people write off as normal aging: fatigue, unexplained weight changes, mood swings, difficulty sleeping, heart palpitations. Every one of those gets blamed on getting older, on stress, on menopause. Meanwhile, the thyroid is running unchecked. Untreated hyperthyroidism accelerates bone loss. It damages the heart. It destabilizes your entire metabolic system. In severe cases, it triggers a life-threatening emergency called thyroid storm, a sudden extreme surge of thyroid hormone that can cause organ failure. The eyes are often the first visible clue that something systemic has gone wrong. If your eyes have changed, if they look different than they did a year or two ago, if people tell you that you look tired or intense and you cannot figure out why, do not dismiss it. That may be your thyroid asking for help through the only window it has. You just heard about 3 signs: cholesterol deposits ringing your iris, a liver in distress turning your eyes yellow, a thyroid condition pushing your eyes forward from behind. 3 different diseases, 3 different organ systems, all of them visible on your face right now if you know where to look. And here is what usually happens next. People watch this, feel a flicker of concern, maybe glance in a mirror, and then go back to their day. Nothing changes. No appointment gets made. No test gets ordered. The sign stays right where it is, and the disease behind it keeps progressing. You have a better option. If anything in this video made you pause even for a second, the smartest thing you can do right now is find out what screening and care options are actually available to you. Care Health is a free platform that matches you with healthcare options, screenings, clinical trials, and new treatments in your area. Whether it is a cholesterol panel, a thyroid screening, a cardiac evaluation, or access to clinical trials you did not know existed, they connect you with what is relevant to your specific situation. All you do is fill in a short form. Date of birth, gender, whether you have children under 18, takes 30 seconds, no cost, no commitment, no obligation. Click the link in the description, or scan the QR code on screen. Just point your phone camera at it and tap the link that appears. As a doctor, I would tell any patient sitting across from me the same thing. Knowing what is available to you is the first step. Take it. Now back to what your eyes are telling you. This one is not subtle, but it is brief, and that brevity is exactly what makes it so dangerous. You are going about your day, making coffee, walking to the mailbox, sitting at your desk, and suddenly a shadow drops across part of your visual field. It is like someone pulled a gray curtain down over one eye, or smeared dark mud across your lens. You blink, you rub the eye, and within seconds, maybe a minute at most, it clears. Vision comes back. Everything looks normal again, so you move on. That is the most dangerous thing you can do. What you just experienced has a name, amaurosis fugax. It means fleeting blindness, and neurologists treat it like a fire alarm. What happened is this. A tiny clot or a small fragment of plaque broke loose from the wall of your carotid artery, the main artery in your neck that feeds blood to your brain. That fragment traveled upward and briefly plugged the artery supplying your retina. Blood flow stopped, the retina went dark. Then the clot dislodged, blood returned, and your vision came back. Here is what you need to understand. That same clot, 2 millimeters to the side, lands in a brain artery instead of an eye artery, and then you are not dealing with a 1-minute blackout. You are dealing with a stroke, loss of speech, paralysis, permanent brain damage, death. Research shows that a transient ischemic attack like this frequently precedes a major stroke within 72 hours, 3 days. That is your window to act. This is not eye fatigue. This is not the same as floaters drifting across your vision or the shimmering zigzag lines of a visual migraine. Those have entirely different mechanisms. A curtain of darkness dropping over one eye is vascular. It means a vessel is compromised, a clot is forming, and your brain is next in line. Call your doctor today, not next week. Today. Everyone gets red eyes from time to time. Allergies, a bad night of sleep, wind, chlorine from a pool. That kind of redness shows up, you rest or use some basic drops, and it goes away. That is not what I am talking about. What I am talking about is redness that keeps coming back. Redness that settles into one specific area rather than spreading evenly across the eye. Redness that brings pain with it, or sensitivity to light, or a deep aching quality that feels like it is coming from behind the surface. You use over-the-counter drops and it calms down for a day or two, then returns. You blame it on screens, on dry air, on aging. Months go by, maybe years. Here is what may actually be happening. Chronic or recurring eye redness like this can be a surface symptom of deep systemic inflammation, conditions like uveitis, inflammation inside the eye itself, or scleritis and episcleritis. Inflammation of the outer layers are frequently associated with autoimmune diseases. Rheumatoid arthritis, lupus, ankylosing spondylitis, inflammatory bowel disease. The immune system has turned on the body's own tissues. It is attacking joints, kidneys, blood vessel walls, and the eye is simply one of the places where that attack becomes visible. Many people with undiagnosed autoimmune conditions spend months or years masking the eye symptoms with drops, never realizing the redness is a signal from a system-wide process that is quietly damaging organs they cannot see and cannot feel yet. The eye is not the disease. The eye is the messenger. If your redness is persistent, recurring, painful, or light-sensitive, and standard drops are not resolving it, that is not a cosmetic problem. That is your immune system asking to be investigated. This is the sign that hides in plain sight for years because it causes absolutely no discomfort. Soft, flat, or slightly raised yellowish patches, usually near the inner corner of the upper or lower eyelid. They do not hurt. They do not itch. They do not itch. They do not interfere with your vision. They just sit there quietly, and most people who have them assume they are a cosmetic blemish, a skin thing, something to maybe ask a dermatologist about if they ever get around to it. They never get around to it, and that is the problem. These patches are called xanthelasma. They are deposits of cholesterol beneath the skin of the eyelid, and while they are technically benign growths, what they represent is anything but benign. Studies have shown that people with xanthelasma have a significantly elevated risk of heart disease and atherosclerosis, even when their blood cholesterol numbers come back within the normal range on standard lab work. Think about what that means. Your body is depositing lipids in visible tissue you can see with your own eyes every morning. That is direct evidence that the same process is happening in places you cannot see. The coronary arteries, the carotid arteries, the aorta. The vessels feeding your brain and your heart are accumulating the same material that is sitting right there on your eyelid. This is a cardiovascular fingerprint on your face. People live with it for 5, 10, 15 years because nothing hurts, nothing bleeds, nothing changes. Meanwhile, the arterial version of the same deposit is narrowing vessels that keep you alive. If you have these yellowish patches near your eyelids, do not wait for symptoms. Get a full cardiovascular workup. Lipid panel, vascular assessment, cardiac evaluation. Do not let anyone dismiss xanthelasma as cosmetic. It is your circulatory system putting its warning label in the one place you are guaranteed to see it. This is the sign that requires nothing more than a mirror and decent lighting. Look at both of your eyes. Look at your pupils. The black circles at the center. Are they the same size? A slight difference, up to about 1 millimeter, can be completely normal. Roughly 20% of the population has what is called physiological anisocoria, a minor, stable, lifelong difference in pupil size that means nothing. If your pupils have always been slightly uneven and no one has ever flagged it, that is likely your baseline. What I am talking about is something different. A new asymmetry, one pupil noticeably larger or smaller than the other when that was not the case before. That is a neurological signal, and it needs to be taken seriously. Here is why. Your pupils are controlled by two competing branches of your autonomic nervous system. One branch dilates the pupil, the other constricts it. They work in constant balance, adjusting to light, to focus, to arousal. When the nerves controlling one pupil are damaged or compressed, that balance breaks. One pupil stops responding the way it should. The list of things that can cause that compression is not a comfortable one. A tumor, an aneurysm, a stroke, increased pressure inside the skull, certain types of nerve damage in the neck or chest. This becomes especially urgent if the pupil change is accompanied by a headache, drooping of the eyelid on the same side, double vision, or neck pain. A dilated pupil combined with a drooping eyelid on the same side can indicate a posterior communicating artery aneurysm pressing on the third cranial nerve. That is a neurosurgical emergency. But even a new pupil asymmetry on its own, without any other symptoms, deserves prompt evaluation. Your nervous system does not change without a reason, and it is leaving that reason in the one place you can see it. 7 signs. 7 different diseases. Every single one of them visible on or around your eyes before most people feel a symptom anywhere else in their body. Now the question is what you actually do with this information. Here is your action plan. 1. Go to a mirror right now and actually look. Check the whites of your eyes for any yellow tint. Look at the outer edge of your iris for a grayish or yellowish ring. Examine your eyelids, especially near the inner corners, for soft yellowish patches. Compare your pupil sizes in even lighting. This takes 2 minutes. You have the knowledge now, use it. 2. If you notice any of these signs, do not diagnose yourself and do not panic. Write down what you see in plain, simple language. Note when you first noticed it, or if you are seeing it for the first time today. Bring that written note to a doctor. Do not rely on your memory in the appointment. Memory edits. Paper does not. 3. Schedule a dilated eye exam, not a glasses prescription check, a full dilated retinal exam where the doctor can see your blood vessels, your optic nerve, and the tissue at the back of your eye. For anyone over 50, this should be happening every single year. Most people do not do this. Most people are wrong. 4. Stop separating eye health from whole body health. Your eyes are connected to your heart, your liver, your brain, your thyroid, your immune system. A proper eye exam is a cardiovascular screening, a neurological screening, and a metabolic screening compressed into one appointment. Treat it that way. 5. If you have risk factors, high blood pressure, diabetes, a smoking history, family history of stroke or heart disease, tell your eye doctor before they start. It changes what they look for and how urgently they look. Your body communicates constantly. It does not send text messages. It does not write you emails. It sends symptom signs and changes. Small ones at first, easy to miss, easy to dismiss, easy to blame on aging or tiredness or bad lighting. Your eyes are its clearest channel. They are the one place where the inside becomes visible on the outside, where blood vessels, nerve tissue, and metabolic damage stop being invisible and start being something you can see with your own eyes in your own bathroom mirror. Every sign we covered today is something you can check. A yellow ring around the iris, yellowing of the whites, eyes that are pushing forward, a curtain of darkness dropping across your vision, redness that will not leave, cholesterol deposits on your eyelids, pupils that no longer match. Every condition behind those signs is something that responds better to early action than to late panic. Every single one. Nobody at your next 12-minute appointment is going to sit you down and walk through this. There is no billing code for teaching you how to read your own eyes. That is not how the system works. That is exactly why this channel exists. And remember, that free health screening link from Care Health is still in the description. 30 seconds could make a real difference. Take care of yourself.